These are the objectives for the session, and what we're planning to do is share the key findings from the inspection carried out in care at home services from October 2020 to the 31st of March 2021. Now, we do recognise that things have moved on a wee bit since then, but we thought it's useful to share this because you'll see in a moment, although the findings are taken from a very small sample of inspections over that period of time, it was mainly for the fact that we were focusing on higher risk services or services deemed to be higher risk. But we thought sharing the learning would help those who haven't received an inspection yet to maybe have a wee think about, well, could this be in my service? And again, we'll talk you through the high level stuff and then we'll go into a wee bit more detail. Again, the session's all about, it's not to hit anybody with a big stick, it's about sharing learning, about sharing what we're finding, but also to signpost you where you can find good practice documents that will help you, both to help folk who may be recovering or you're supporting folk who are maybe have been affected, not just by COVID itself, but the indirect effects of COVID. So there's lots of good sites that you can access to get that information and encourage your staff to do so. And at the end of it, we'll summarise it into some take-home messages for you. And as I said, the Q&A, please use that function because we're happy to, like I said, if we don't know the answer, we'll find out for you. Next slide, please, Lindsay. So this is a kind of, for me anyway, it's a really important slide. The transmission rates across Scotland, if you've been watching the news, you'll know it has been sort of starting to rise quite a bit. This is a site that the care inspectorate staff will use as part of their planning. And what we're looking at here is if you look at it on the left-hand side, that's a sort of demographic by age. And if you don't use these sites, please go in and have a look. It's fantastic information that will help you and help you inform your decision about, even if when you're moving staff around the country or you're moving staff across local authorities, you can break it down into that level. But it gives you, the chart on the left just gives you a really good overview of the kind of age group, and it won't surprise you when you look at the figures, but what you have to think about is that's the age group that's shown there is the highest transmission rate, so this kind of age group that work in health and social care. So it might help inform your thinking, over time, like, what else can I do to support the staff to keep them focused and making sure they wear their PPE correctly, making sure that they're continually washing their hands, the good practice side of things, just to try and mitigate any further risks. And again, if you are watching the news, you'll know that the R number is slowly creeping up to, it's set between I think 0.8 and 1.1 as of yesterday. So again, we're starting to get into that area, whereas we went above 1 before, we went into that lockdown stage, and I know that's not going to be happening, but I think it's something especially for care at home services and their staff who are moving across local authority areas to really be mindful of. So please, you'll get a copy of these slides, and these links will help you because again, this is not the time to become complacent at all. Next slide, please. So these are the high level findings that we picked up on as an inspectorate during that period that I mentioned, October to March. You'll see there that there, there'll be any surprises in it. Quite a lot were related to personal plans or the accuracy of personal plans or reflecting the current situation within that person's life. Medication management was also picked up on, and again, I'm just giving you the high level findings here. My colleague Lorraine will go into some of the detail that surrounds these things. As you can imagine, infection prevention and control features heavily for us, and that includes some of the questions that came up around, the relationship when you get into somebody's home around cleaning and various other bits and pieces. But again, Lorraine will pick up on some of the supporting factors in relation to that. We also picked up on the quality assurance, and we've got a really, I think it's a fantastic example, and it's quite recent in relation to staff practice and how difficult it is, to quality assure what's happening in the field or out there once the staff have left. I mean, some of them go from their own home right onto site or right into people's homes, and others have to check into a building base. But how do managers quality assure that whatever systems and processes have been put in place, that the staff in the field are actually following them? And again, we've got a really good example of that, and Lorraine will cover that in a minute. Staffing levels wouldn't surprise you there, and we do recognise that there is issues with recruitment, issues with sort of the isolation periods that are happening when people come into close contact. And if you've already picked up, there's really good guidance out there for health and social care staff around PCR testing supported by LFD, but again it comes back to personal choice, and the links will be available for you in relation to that. And although I'm using ineffective management arrangements, that's what's actually stated in one of the documents. I think it's bigger than that. It's about leadership, and again, Lorraine will cover that as we go through this. I think we have to recognise, there's over 1,600 support services and care at home services and combined services out there. And the inspections, like I said, we undertook were all based in high risk. So these findings are all from a very small sample that you can see up the top there. There was 9 services, but the level of inspections were 30. So if you work that out, that's an average 3 inspections that somebody we've had in 6 months within one service. But the actual requirements were made weren't that many, but it's more to do with how do we learn from this, and going away and asking yourself, could this be in your service? And they were mostly in relation to key question 7, although we did look at the sort of wider health and welfare. So like I said, although we'll be discussing a lot of this around key question 7, you will be aware that the quality framework's under review, and we're starting to weave key question 7 through the quality framework. So the issues with IPC, PPE isn't going away, we've actually embedded it in. So as we move towards business as usual, it's really important that you take away today the things that we're highlighting to you and really having a look, like I said, to see if this could be happening in your service. And I hope you take it. I mean, it is really all about sharing the learning from the higher risk services that we've been inspecting. I'm going to hand you over to Lorraine, who will take you through some of the detail and also signpost you to where you can actually find some really helpful information in relation to the things that she'll be discussing. Thanks, Lorraine.
Thanks, Jackie. Oh, there we go, I'm live now. Hi folks, good morning to you. I'm Lorraine McDonald, as Jackie says. I'm going to be running through the high level findings in some more detail. Next slide, please. Perfect. The detail I'm going to share with you is from a small select number of services that we're inspecting. However, we must recognise that care at home, house and support services covers the sublime to ridiculous, whether you're going into somebody's own home. It also covers things like very sheltered housing. So we're hoping by the end of this, by sharing some of these findings, that you can begin to look at your service and say, is this possible? Could this be happening in my service? This has tripped up other services. Could it trip up us? Maybe, maybe not. Okay. The first finding was the first set of findings is relating to personal plans. Okay, and that was from the quality indicator 1.7. So that's people's health and well-being supported and safeguarding during the COVID-19 pandemic. You'll know all this before. Okay. Personal planning is, although we were focused very much on COVID-19, personal planning continues to be an area of improvement, and not just in the COVID-19 context. So I'm really just going to touch on this because I could go on for weeks and months speaking about personal plans, and everybody's got their own view, and the easiest thing in the world to rip apart. But what we need to focus on is it telling us what we need to know about that person and the person's care that we need. Although there were a number of concerns about personal plans, some were the direct impact of COVID or of shielding, but a significant number were as an indirect consequence of COVID. So services and the service delivery was changing. So, we know it was difficult for you getting staff in. Some resources were pared right back. And also physical isolation had a big impact on people's health and well-being, and that was also compounded because sometimes families weren't in either and friends weren't in, so loneliness on top of that had an impact, then had an impact on people's behaviours, stress, distress, etc. around about that. Care support and housing support staff have been key basically over the past 18 months, being frontline on there, being the main contact with many people in the outside world, and your assessment and skills and, you know, ability to look after people have been crucial. However, we did find there was some problems, and the problems that we identified were that although within care plans perhaps a problem was identified or people's needs were identified, but the follow-up action wasn't being addressed properly or wasn't being implemented properly. So therefore, the care plan itself maybe said that somebody had an issue with, say, stress and distress, but the action to address that wasn't being implemented. Action wasn't taken quickly. If planned care wasn't being able to be delivered as planned, obviously, or the person didn't want that planned care, there wasn't changes made within the care planning to ensure that everybody was doing the right thing at the right time for that person. It needs to be a whole team approach with a care plan, as you know, to ensure consistent practice and to ensure everybody, all your staff, understands the aims of what they're trying to achieve for that person. Often things would happen and they would never be written down within the care plan or changes put in place. And as we know, care plans, the way I like to think about care plans is the care plans are like another member of staff. But they're the member of staff who's going to be the consistent member of staff. You wouldn't dream of something happening within your service and not passing that on to the staff that are there. But what about the staff that are not there? Your personal plan should be seen as a member of staff who's always there in that person's house, and they're going to be able to tell everybody else what's happening. There's a host of good practice information out there on our hub about how to address people's needs, whether that be nutrition, hydration, whether that be stress or distress. All the information is on our hub, and I'll give you links to that later on. Next slide, please. Infection prevention and control. Now, as you can imagine, we've picked up quite a lot of issues around about infection prevention and control, but that was mainly due to just the focus that we had during the quality indicator 7.2. Again, this was quite difficult to look at from an inspector point of view, because as I've said, house and support care at home covers a huge wide remit, but the principles behind infection control were what we were looking at. You are aware that the IPC addendum for community health and care setting continues to be applied as long as we're in the pandemic. Now, we've needed to take, and you need to take, a proportionate approach as how we look at individual cases and how they arise depending on which service you're in, what type of service you're delivering. As the appendium covers a whole wide range of services. If your service has an enablement function, and obviously that's very, very important, then it's really important that we maintain that. However, the manager provider needs to ensure that guidance is embedded into practice, just as you would do with any other kind of guidance legislation out there. Okay, so same with fire safety, food safety, COSH guidelines. So for example, now sheltered housing complexes with communal living, how are we going to ensure the communal areas are clean, tidy, well maintained? What kind of processes are you going to be put in place there? However, if you're in somebody's own home, okay, the guidance is there as an overall catch guidance, but we need to be thinking, we can't be telling somebody what solutions for cleaning chemicals to use in their own bathroom to clean it. However, if your staff are cleaning there, you need to make sure the systems and processes are in place to ensure that they know the standard of cleanliness required. Staff practice needs to be related to and effective to ensure good IPC practices are vital. All right, so round about training, the issues that we picked up, particularly in housing support and care at home, were relating to staff not completing the training that we were asking them to undertake. So especially if that was e-learning, just became a tick box exercise. That then moved on to, was the training effective? Round about competency of staff, putting the training into practice. An example Jackie spoke about is a classic one for this. Staff members had all the e-learning training, that was fine, but staff member was observed very recently coming out of their car in full PPE, so wearing a mask, wearing aprons, wearing gloves, walking at least 50 meters down the road, the main road, because it couldn't get parked outside the person's house, okay? By the time the person who was witnessing this caught up with them, they were already in the client's house, okay? Now, you and I know that's totally unacceptable. Why we're getting out of the car wearing full PPE and walking down the street? Okay, as I said, the members of staff had their training, so why would they do such a thing? You know, it just is totally against all infection control practices and training out there anyway. But I'll talk about quality assurance later on. There were specifics that we were picked up on in relation to PPE, which we've already spoke about, cleaning of equipment and the environment, hand hygiene, the management of waste and laundry, but also some staff were totally unaware of IPC guidance. The addendum, when we spoke to them, totally unaware, didn't think this applied to them, didn't even know about in some cases, and information and guidance on community healthcare settings. They just carried on as they had done before, or the training they picked up was from a colleague. So it was pass me down, pass me down, pass me down. That's never the best way to share information. There's lots of useful and helpful information training guidance on PPE and IPC available for you and your staff, and I'll direct you towards the TURAS site. That's the NES site for that, NHS, the SSC, and also our Care Inspectorate hubs. But there's lots of other very helpful, useful information out there. Next slide, please. Quality assurance systems. Okay. Now we've looked at this specifically in relation to IPC and the cleaning of equipment. Now you will have your own quality assurance process and systems, but are they doing what it says on the tin, or are they improving outcomes, or are they just a checklist? Think back to the scenario of the carer putting on her PPE before she walked down the street and into somebody's house. Sounds ridiculous that 18 months on, something like this still could be happening. Now, is this complacency? Is it the staff member thinking they know better? Is it lack of training? Is it somebody that, as a manager or a provider of a service, were you aware that this had been happening? But how do you find out? How do you know? That's where your quality assurance processes come in. And that's very difficult if it's a one-off incident, or if it has been a reoccurring thing, or it's just something that you've just been totally unaware of. Your quality assurance system is a system that enables you to try and find out what's going on in your service. Are we asking the right questions? Are we doing the right thing? How do we know what's going on? Are we putting the processes together? Where it's important that we do some spot checks, monitoring of service, observation of practice, getting feedback from people, asking the right questions. Are things improving? If not, discuss with staff. Why are they not improving? Are there issues around about that? Any suggestions from staff that would make life better, that would improve outcomes for people, that would ensure good practice is maintained? The whole point of a quality assurance system is to meet agreed standards. And if you're not meeting them, we need to try and determine why we're not meeting them. Generate outcomes, look at systems, look at processes. It's not just about systems and processes, it's about that human factor, that member of staff wearing their PPE wrong. By collating all that information, going back, looking at it, you'll have heard of the PDSA, the Plan, Do, Study, Act cycle of quality assurance. That's basically what we're asking you to do, is plan how we're going to review something, do it, study to see the outcomes, and then act to see, has it improved, has it not? If not, get back to the start and redo things around about that. Next slide, please. Correct PPE was one of the things, again, we've picked up on. It's highlighted that staff need to ensure that they're wearing the right PPE at the right time for the right reason, and that's crucial in the whole trying to prevent the cross-infection, infection spreading, etc. Not just for COVID, but as things start to come back, normality, business as usual, whatever you want to call it, we need to make sure that it's not just COVID that we're spreading, but there are other bugs out there. So we need to make sure we're using the right PPE. Now, at the start of this pandemic, staff were so good at the old donning and doffing stuff. And they got it spot on, it was vital, but complacency starting to set in now. Remember staff wearing a PPE from the car? Knowing how to dispose of PPE is crucial. Remember at the beginning of this, people were reporting that staff were putting masks outside in waste bins, etc. You need to make sure that when staff take off their PPE, they know how to dispose of it safely in a safe place. We advise that PPE is removed and masks are removed immediately on leaving people's home, placed in disposable bags, and then disposed of through local arrangements that I'm sure you've got in place for your staff. It all comes back to quality assurance and training and how you monitor staff practice in amongst all this. The other issues that we're picking up are on gloves. We're still seeing vinyl gloves out there. We know that vinyl gloves shouldn't be used for personal care. And there's an appendix, which I'm sure you've seen, that enables you a flowchart that enables you to use the best glove for the right job there. Fluid-resistant surgical face masks not being worn appropriately. They're hanging underneath somebody's chin, off of your ear, your nose poking out, used as a nice little chin warmer. Okay, so make sure the staff are wearing their mask properly or know how to wear the mask properly. Basically, staff becoming complacent. There is a false sense of security out there. Staff have been double vaccinated. They're on their routine testing. There's reduced, there was reduced transmission rates in the community. That's on the increase again. People thinking we're out the woods, so why do we need to bother with this? But as you know, the community transmission rate is on the increase. Being double vaccinated is not a catch-all that's fine. I'm never going to catch COVID. I'm never going to spread COVID again. That is not the idea at all. It does happen out there. You need to make sure the PPE is worn correctly at all times and for the correct reason. Okay, next slide, please. Jump on to staffing levels. Now, I know this has been a huge issue for you out there, and there is a huge challenge in one, recruiting staff, to retaining staff, but also staff's anxiety levels are huge out there, and we understand that. And there has been a huge impact on staffing levels, and therefore the level of service that you can actually deliver to people out in the community. I'm not going to say too much about it, but I'm just going to direct you to let you know that we are aware of this, and there is ongoing work through the SSSC, but also the Safer Staffing Project is ongoing, and we're hoping that that will help the sector out there by individuals being supported and reassured and encouraging people to join the social care sector. As providers, as managers, the legislation is quite clear that we should have sufficient numbers to provide appropriate health and welfare and safety to our service users. So it's just an area that we're picking up on, but we know the challenges behind that for you. Next slide, please. We've labelled this one as ineffective management because that's the appropriate title for if we're writing requirements. Okay, we have to follow the legal terminology behind it, but it's not just about managers. Okay, it's about leadership on a daily basis. It's ensuring that it's about having robust systems and processes in place to support care and delivery and address issues quickly as and when they arise. It's all about your quality assurance system again, getting back to that old chestnut, making sure that the standards that you want implemented and we need implemented are being met. So therefore, everybody has a role to play in this. As you know, the new registered managers requirements were published in June, and these covered what's expected of an appointed manager in the service. So we're looking for the managers to be qualified to SCFQ level 7. Why do we say that? Okay, why do we ask for such a high standard? And this is because the managers provide leadership for the staff. They're ultimately responsible for any decisions made regarding service delivery and the competence and the fitness of the staff. And we also believe the managers having relative practice knowledge will fulfill that role to a reasonable expectation. The issues we found round about ineffective management where there was poor communication, both internally within the service, but also externally. So speaking to partners, getting the support for people when they were needing it, all that was missing. The communication was lacking. There was a lack of understanding or limited understanding in the role and expectations of the manager. And as I've said, what we're looking for in the manager is really quite a high level. And if your manager doesn't understand the expectations of that, then that can lead to problems. Ineffective monitoring of practice and outcomes for people. So the bread and butter stuff, if the manager or whoever's leading that shift doesn't know what's happening within people's own homes, that makes it extremely challenging and the outcomes for people cannot be improved upon. And obviously poor quality assurance systems where they've just been used to tick boxes and they don't actually improve outcomes for people. So we need to be asking why are we doing this and what we're trying to achieve. Okay, and it's not about bits of paper. It's looking at how does this improve people's outcomes. There was a lack of oversight into people's well-being, particularly for those in the vulnerable scale. So if we're speaking about adult support and protection, for example, a carer goes in to do a regular visit on a person, but that person's not in on a number of occasions. What systems and processes are in place to liaise with other professionals to say, is this an issue that person's not been in? Or do we just let it go? No, we don't. But it's all about that joined up working. Okay, adult support and protection, looking after our vulnerable people out there. So in summary, what I've covered is the high level findings specific to COVID-19 and other guidance, but it's much wider than that when it comes to service delivery and context. We are, as I've said, we want you to try and look at these. Could this be an issue that could trip up your service? Okay, that's all it is. And if you have a look at your service and think, well, maybe that's not tight, where do I get guidance? Where can I look at that? Where can I get good practice? Where can I address these issues that potentially could trip us up? Because we want to see services thrive as well. We don't want to be coming in to do these improvement notices or giving low grades. We would love to see great services out there performing very high standards and meeting all the requirements. Okay. I'm going to hand you back to Jackie to finish off. It has been a whistle stop tour, but any questions, queries, please pop them in the chat for me and I will try and answer them. Thank you.
Thanks, Lorraine. Slide, please. So, as Lorraine said, this isn't about sort of, we know there's lots of really good practice happening out there, but this is really focused on higher risk services. And again, it's just to help you refocus or have another rethink. Like we were saying, the transmission rates are going up. There's probably loads of reasons for that. but basically it's people's behaviours that are driving the COVID-19 virus, and I know that that's me speaking to the converted. This isn't anything that you don't already know. So for us, from a care inspector point of view, Lorraine and I both work in the COVID flexible response team of the care inspectorate. We were repurposed away back in March. Our team is going back to the substantive posts at the end of this month, and part of our process is to make sure that we leave, our legacy will be that we're leaving behind really good links to where you can find good practice that will help you going forward. You know, so that you're basically inspection ready, but you're also outbreak ready as well. Because again, as the transmission rates go up, your staff are working in these community areas, you know, that sometimes can be a bit unstable. You just don't know what you're going into most days, and so it's really important that your staff are really aware of the addendum while we're in this pandemic, because there's this fantastic triage information in there that will help you plan care as well, and let you know the risks. Where you're putting staff, and the staff know the risk before they go in as well. So all of these types of good practice documents or information that will help you, very specific to COVID and the well-being of people, are found in our compendium or on our website. Now, as a COVID team, we've pulled together really all the key links for adult services, including care at home, including agencies. They're all in there, and we've broken them down by adults and even for children as well. So they're all in there, and we regularly update them, and there'll be somebody keeping an eye on that once the COVID team is no longer in post. So again, it's really useful just to know where to go and find this information. It's like a one-stop shop for you. And you should find most things on there, if not everything that you'll need, or links to really good sites that, you know, that are validated, that will give you really good information to either re-educate staff, refresh staff, or help you inform your thinking about, you know, what the care you're providing. You'll also find the Community and Health Settings Addendum, so that will be there. You'll find links to the HPS website, or ARHI as it's now known, and Public Health Scotland in relation to the social, community and residential care settings guidance, which I'm understanding has been updated at the moment. So it's really important, you know, you set up something in your systems to regularly dip in and out of these key sites, so that you're always up to date with the most up-to-date information. But if in doubt, use our compendium, because we've hyperlinked things, and as long as the links don't get broken, then it will take you to the most up-to-date guidance that's available for that particular document. And like I said, it's broken up for you to make it easy to find information. We've also got, as Lorraine mentioned earlier, we've got our professional hub, if you don't know about it already, and on that you'll find lots of guidance around nutrition, you know, medication management, bowel and bladder care, dementia care. So again, where there's really good documents, we've hyperlinked them, and where there's good practice statements or whatever, you'll find them all in there as well. So it's a really good resource if you're refreshing your own education packages for your staff, or there's a particular issue that you really want to focus in on. Next slide, please. And that's a summary there. That's what Lorraine was alluding to earlier. And we'll make sure that all these links are checked again, because again, every single day is a school day for us here at the Care Inspectorate, as well as things are changing, and we're always checking these websites. And we can't stress enough on the NES, if you've got staff who are not joined the TURAS platform yet, I would encourage you to get them to do that, especially for their own CPD. There's lots of things in there in relation to home care, and it's really good as well, because you'll be able to get involved if they're developing anything. Sometimes they'll put things up and they're asking for, you know, feedback or whatever. So it's a really good way for you to influence what's happening. I'm not saying it happens all the time. You'll probably find that your managers and services are already, or the providers themselves, get involved in these things. But it's a really good site if you're looking for up-to-date information for CPD purposes. And like Lorraine was mentioning earlier, there's ones in gloves use, so it's there as well, the registration requirements, the link to the hubs there. So again, we've tried to pull together the most useful resources, as well as your Public Health Scotland sites. Next slide, please. So what's the take-home messages for care at home and housing support services combined, no matter what you do? The take-home message is the IPC addendum that you should all be aware of will stay in place until the pandemic is declared over. You know, when that's going to be, I'm not really sure, and I'm not really sure whether it'll be like, you know, a formal announcement. I'm sure we'll all be told in good time. But as you can imagine, with the transmission rates rising, there is a lot of anxiety out there. There's a lot of you know, what will happen next. So as providers and as managers of services, it's really useful if you can keep your staff up to date. Some providers are using a thing called Sway. If you Google Sway, it's a free like newsletter type thing, so it's a really good way. If you've got email addresses, you can get key messages out to staff really quickly, and it formats it for you and it puts it into a nice newsletter format, and you can make it in big print if you've got folk who've got visually impaired, or you can do it for your service users as well if you're trying to get information out to them in a quick way. So I would recommend you go into Google Sway, and you'll be able to find information in that. It's a part of an Outlook package. It's also really important that you're outbreak ready. So are your staff clear on what needs to happen and when? So it might be quite useful to revisit that with your staff and make sure they all know what they should be doing if they turn up at a door and it's been triaged that the person is in a sort of lower risk pathway, but then they get there and they find out that their partner, whoever, is tested positive. What should they do? What should that kick off in the process? And as you know, there's an outbreak ready checklist on the HPS website. So again, it might be quite good to run wee mini drills with staff. I don't know how you would do that, but again, you know how your services really work with your systems and processes and how you do that. But it's just to make you aware there's a really good document in the HPS website. As providers and as managers who are on the call, and as individuals, we need to be able to prevent complacency creeping in, and because I said earlier, human factors play a big part in this. So there's a campaign coming out, I think it's called Right to Be Kind, or words to that effect, and it's back to the scenario that we highlighted earlier, where the person who observed the practice or the poor practice of the member of staff walking down the street with their mask and their gloves and their apron. People don't take kindly to be challenged, even if they're in the wrong, and that was clearly a wrong thing to do, was walk down the street in your PPE. I don't know why, like I said, I still kind of wrap my head around it. But the person who would witness it, you know, it was after the event, it was like, well, what would have happened if I did say to them, if I had managed to catch up with them and say to them, do you realise what you're doing is inappropriate? Because again, you don't know all the factors, what's happening in people's lives or whatever. So it's really important that staff feel comfortable to call each other out without it getting into a big drama. And again, that's something as providers and as managers you could encourage. You know, if your staff are going out in pairs to help and assist people in their own homes or within a very sheltered housing complex or a housing support service, even if it's just, you know, assisting somebody with their shopping or whatever it may be, if they're witnessed like wearing their mask or no wearing their mask correctly or no wearing the right gloves if they're providing direct care, staff should feel comfortable to highlight to their colleagues that they're not following good practice, but it's how it's done and how it's managed. So that the tension isn't there, because people don't like being pulled up for things, but I think it's really important that, you know, staff really feel comfortable to do that, so that we do keep the sort of transmission to a minimum, because at the end of the day we can't take control of what happens out with a workplace, but when we're in the workplace we can, and it's important that we reinforce that message, because if we reinforce it in the workplace, then hopefully it'll transfer into their personal lives as well. And if you look at the age group that we're talking about, it's mainly that health and social care staff age group that are transmitting the virus. Just generally, that's what the statistics are telling us. The other thing is, like we were talking about earlier, is keeping an eye on things locally. What is the transmission rate within the area that you're providing staff to? And again, it might be worthwhile revisiting if the transmission rates are really climbing, having a really good chat, or if you're using some form of mechanism, whether it be a newsletter or whatever, just to lift things off of that website and put it out to staff and put it into context for them. This is the area you're working in. This is a transmission rate. Please be mindful, you know, that you follow the correct PPE, IPC practices or whatever. Be vigilant. However you want to do that is really important. that you keep those things in place as we move towards business as usual. And like I said, this is all about making the right choice at the right time for the right reason. The guidance at the minute is open to interpretation because we're moving back to, like I was saying, business as usual. But there has to be an element of being able to escalate that up and bring it down again as and when you need to, based on the situation that your staff are experiencing. Next slide, please. So finally, that has been really quick, and if you've got any questions, please pop them in the chat and we'll answer them. And if you don't know, then we can take it back with us. Yeah, Lorraine.
Jackie, sorry to interrupt. I think I'm in the chat now. I'm really sorry. I've missed out a wee bit about medication. So I must apologise. So is it okay if I chat about that just now?
Absolutely, absolutely. Do you want to go back to that slide, or are you okay?
Well, it seems to be not in the slide pack, so awful sorry about that, folks. It's Friday. We've done about 7 of these over the whole week, and I think I'm getting worse instead of better at this, so I apologise completely, but bear with me because I don't like public speaking anyway, never mind to a computer. Medication, the issues around about medication, again, most of these are not specific to COVID. It was an area that we're always going to pick up on, the same as care planning, but the issues were around the safe administration and recording of medication. So it's that old chestnut again about systems and processes, quality assurance systems, and staff not knowing what they should be doing or not implementing what they should be doing effectively and properly. Now, there's lots of guidance around about medication out there, which I'm sure you'll use and you know about. We've got the best practice guidance from the NMC for if you have any trained staff, but if not, that's still a very good document to use. There's the professional guidance on the administration of medications, and there's also the NICE guidance for the administration of medication out there. And I can pop all the links to them in the chat later on for you. But again, they'll be on our website for all the information you need on medication to make sure. But the issues were around just the recording of medication and the safe administration of medication there. There was also some elements crept in about the use of covert medication. I know it's not that widely used out in the community, but where it has been used and where it was used, we did find some discrepancy in that, just making sure that the pathways weren't as robust as they could have been. I hope that answers that. I hope that gives you a wee insight into our findings. Not a huge amount different to what we would have found before COVID. Hope that helps. Sorry, Jackie, to interrupt you there.
There's a really good document as well on the Care Inspectorate Hub. It was been done by our pharmacist. As you know, we've David Marshall. He is a pharmacist and he has done some work, although it be in a care home setting. It's around medication errors and how to reduce them. So again, you could use the same principles that are within that document to look at the practice within, you know, your own staff group, or you could use it as a learning opportunity, but you'd need to adjust it obviously for your particular setting. But it is a very good, it's quite an eye-opening document when you think about it, because again, medication administration, I know we've got support staff who do that as well, but it's like a task thing, and some people just go into the task mode and they don't really think about what they're doing, and he picked up on this, so it is a very interesting document. It's based on services coming forward and asking for help, basically, how can we reduce medication errors, and David worked with them on how to do that. So as I said, the principles are really good, so well worth a read if you can get a minute. Lorraine, there's a question around the Safer Staffing project. The link you put in there is being led by Angela Fulton, who is a team manager who's seconded at the minute to work with Scottish Government and other key stakeholders around the Safer Staffing approach. It came into legislation, I think it was about May time, it got assent. Is that right? I got that right?
It got royal assent in June, and there is work being done in the background. SSC have got a lovely section on their website, so they're promoting the safer staffing, obviously, and there's been a lot of questionnaires and a lot of issues put out for comment from the sector there. And again, on our website, there's a section on the safer staffing initiative that we're running, and the safer staffing project team that's up and running as well. So I would direct you to them. I personally don't have details of timescales, etc.
There's a plan on the website. It's laid out, you know, where they're going and where they're planning to go, and what they're actually doing, whatever stage they're at that moment in time. So yeah, it's there for you to have a really good read at, because somebody's also at, and you've answered it, Lorraine, anyway, around why we're asking for more information, and that information is feeding into that, so that they've got a really good context of what vacancies or what the workforce is like at the moment, and it's in real time, obviously. So again, that's helping inform decision making and discussions, and you know, future planning as well. And again, how to make it attractive to come and work in health and social care, because it's not always seen as the first choice, especially for maybe younger folk who want to enter the workforce. So how do we? There's lots of things that I think they've taken different strands, and again, the safer staffing project's really well laid out, so you'll be able to have a really good read at that, and it'll tell you what's happening.
Perfect. Jackie, somebody's asking for the link to David's report. Do you have that handy, or we can?
I don't have it handy, but we could find it, and we'll add it into, when we send out the slides, I'll make sure we add it into the useful resources at the end. I'll happily do that, and then when you get it, we'll hyperlink it to that, and it'll all be emailed to you if that's okay. But it's well worth a read, definitely.
Perfect, thanks, Jackie.
Is there anything else that anybody would like covered while we're here before we finish up and you get 10 minutes of your life back? No? Now's your chance. No? Well, all I have to do then is say thank you for joining us. I mean, I hope you found it useful, and like I said, it's about sharing, learning, and maybe this, if this is the kind of thing you'd like more of in the future, then there's a self-evaluation going to be put in the chat for you, and it'd be useful to hear what you thought worked well today, and what was the most useful bits, and possibly what you would like to see in the future if you think this is useful, even just to get an update of, you know, what requirements are being made, or how, you know, what is the collective or the key things that we're finding, because it definitely helps. I think it would help to then focus the mind and let you self-assess what you're doing in your own service, and could this be you? But again, you might have other ideas, so please please use the evaluation form to give us some feedback, so that we can, again, in a good quality improvement way, make adjustments and make it better for the next time. So thank you very much, and have a great rest of your day and a lovely weekend when it comes. So thank you very much.